We are going to study anatomy of umbilicus in detail. Umbilicus is a normal scar on anterior abdominal wall. It represents a site of attachment of umbilical cord in the fetus. Its normal position in adults is between L3 and L4. However, it is found lower in infants and people with pendulous abdomen, means people, obese people, fat people, we can say that, or old age people. Anatomical significance: the lymphatics and venous drainage at the level of umbilicus follows the principle of watershed line. It is a very important question asked in exams. What is a watershed line? Watershed line, let's suppose we are drawing the umbilicus on the anterior abdominal wall, and then we draw a transverse horizontal imaginary line from one side of the abdomen to the other side that passes to the umbilicus. Now, the area above this imaginary line is drained upwards, venous and lymphatic drainage, and the area below this line is drained downwards, upwards by the axillary lymph nodes and downwards by the superficial inguinal lymph nodes. And skin around the umbilicus is supplied by a T10 nerve. Portocaval anastomosis is found at the level of umbilicus. What is the portocaval anastomosis? It is the anastomosis where tributaries of portal veins anastomose with the tributaries of the systemic veins. It has its own clinical significance. In portal hypertension, when blood pressure increases, the anastomosis open up, i.e. the veins dilate and form the appearance around the umbilicus like this. This is called caput medusae, appearance of the dilated veins. It can be seen on the skin. This is called caput medusae. Now, embryological significance of umbilicus. Umbilicus is the meeting point of four folds of embryonic plate. It is the embryonic significance, so we are going to discuss about embryological things like embryonic plate. Four folds meet here, two lateral, one tail and one head, and three systems meet here: digestive system, excretory system, a vascular system. Vascular system because here umbilical veins and arteries are found, and excretory system because urachus passes through here, and digestive system because of vitelo-intestinal duct. Now, clinical anatomy. Remnants of vitelo-intestinal duct may form tumors, i.e. cherry red tumor or raspberry red tumor. Persistence of vitelo-intestinal duct results in the fecal fistula. Fecal fistula, what is the fecal fistula? An abnormal connection between the stomach or gut with the skin, i.e. the components are protruding through this abnormal connection. Persistence of vitelo-intestinal duct. Its proximal part's persistence causes Meckel's diverticulum, and its middle part persistence causes endothelium. In persistence of urachus, it results in the urinary fistula. Umbilical vessels can be catheterized in certain conditions, in certain clinical conditions. Umbilical hernia. Umbilical hernia is a very important clinical point. It is basically protrusions of structures through the umbilicus, and it happens due to weakening of the umbilicus or the normal umbilical scar.